Okay, it looks like we're recording now. So I just wanted to share with everyone watching this, and everyone would be all of our wonderful Mercyhurst University bachelor's in nursing students
Mhm.
who are in Nursing 208, which is the ethics of nursing and chronic illness. So everyone, this is Noelle. And she is Noelle McClellan now,
Mhm.
right?
Yes.
Okay. I was going to call you Little
Perfect.
Agnes, but
You did
okay.
perfect.
And she's a nurse practitioner and she's with us right now, coming from Florida, away from the cold in Erie, Pennsylvania. So, Noelle, if you could just share a little bit about yourself, both education, and I forgot to say, you're an alum of Mercyhurst University.
hmm
So if you could share a little bit about your education, your journey as a lifelong learner, and your clinical expertise and practice.
Sure. So I'm Noelle McClellan. My maiden name was Lilakis. I am originally from Canton, Ohio. I am a three-time Mercyhurst alum. I graduated with my BA in dance in 2008, and I went to dance professionally for a ballet company in Missouri. Then I had ankle surgery and retired into my second career, which was nursing. So I'm an ASN grad of Mercyhurst 2012. And then I started working on the trauma unit at UPMC Hammett. And I also started my BSN, RN to BSN completion program. And I did that from 2013 to 2014. We had a really brutal winter, 2013 to 2014. And I had some family that was starting to snowbird down into Florida. My interest working, I love the trauma floor. My interest grew into orthopedics and as that aspect of trauma. So I was looking for an orthopedic unit to start working on in Florida as I started my master's program at Duquesne. So I came down to Florida and started working on an orthopedic unit at Advent Health Carrollwood. It's a surgical powerhouse hospital just north of Raymond James Stadium in Tampa. So I worked on the floor and finished my MSN and family nurse practitioner through Duquesne. And I also became orthopedic certified at that time and took my boards. Um, Once I graduated with my master's, I started as the spine coordinator here at the hospital, and I ran the Joint Commission disease-specific certification for spine surgery. I also did shoulder and total hip and knee replacement, and had privileges to practice in-house with the spine surgeons throughout the entire hospital continuum of pre-admission testing to discharge. And then the spine surgeons offered me a job at Florida Orthopedic Institute, which is the largest private practice in the state of Florida. I went to be their director of spine services for 2.5 years and learned a lot about the for-profit business side, to include private equity buyouts. My job was unfortunately eliminated. So luckily, I love the hospital that I worked at for 9 years so much that they let me come back. So I'm back working in the quality department. Um, and my focus is going to be on readmissions, namely Medicare core measure readmissions, which includes my orthopedic love of total hip and knee replacement. But if we're looking at all cause, that also will hit spine surgery quite heavily. So that is my background. And I'm currently working on my doctorate of nursing practice through Florida Southern College, which is in Lakeland. And I've been doing that since 2023, and I will be done next summer. That's just about everything.
Amazing, amazing. We are so proud that you started here at Mercyhurst and so proud that you went into nursing and that you're a lifelong learner and working on and almost completing your doctorate in nursing practice. That is truly, truly a wonderful career for a very young woman yet. So
Mercyhurst has a huge hand. I use all three of those degrees every single day.
neat. Neat. So I've got a couple of questions. Some came
Sure.
from students and some I wanted you to speak to,
Hmm.
especially in regards a little bit to our course. In our course, we do talk about mindfulness and complementary and integrative health.
Hmm.
So we have a lot of different topics. To help us really demonstrate compassion in nursing as we care for our patients, especially those that are chronically ill or at end of life. So, but we also talk about taking care of ourselves so we can take care of others. So, what advice would you give to our students about balancing curiosity, self-care, along with academic rigor as they move through nursing school?
Oh my gosh. I believe I have gotten better at this as I get older, and probably after doing a really rigorous master's program, I know what my limits are in terms of what I can commit to. And I know that it's not a great idea to book up every single hour of the day. Like maybe one additional thing every day, one additional event past work every day. Um, or even on the weekends. Sometimes if I have booked myself for more than one event, it gets a little bit hectic, which sounds a little bit crazy, but it's the same principle that I go by when I travel to see my best friend. We only try to book one firm event per day because we know that we have the capacity to get ourselves into a lot of, with our curiosity, we have the capacity to get ourselves into a lot of situations. So I think to balance all of that, you just have to really set a firm boundary. And I've become more precious with what that your time is also valuable, even if you're not getting a paycheck for your time. And it's important to have a good balance of activity and rest so that you can also be good to take care of the people that are, you know, leaning on you to guide them. And patient care, when you get into the upper levels of nursing and when you get into administration, I have always thought of it as you become the nurse for everybody. Like that nurse in you never goes away, even if you're not seeing patients every day, even if you're in more an administrative capacity, even if you're working more with the nursing staff or the clinical staff or advanced practice or the surgeons. Like everybody is human and everyone's a human being, not a human doing. So you have to be really, that's something that I've really tried to be mindful of. And I've also tried to protect other people's time where I have the power to do so, specifically the surgeons and advanced practice providers.
Excellent, excellent. How did your undergrad education here at Mercyhurst prepare you, maybe even in ways you didn't realize at the time, for the realities of our nursing practice?
Oh my gosh. I just every every faculty member in all kinds of situations just taking the time to like point out something that was important or push you a little more to fix something that you could, like pushing the critical thinking envelope. And I think with the liberal arts, kind of that liberal arts bubble around nursing, it really you just get into creative problem solving on a different level. And not only do you get into creative problem solving, but then when you are like pushed into more leadership or you're expected to work in a collaborative effort, a multidisciplinary effort, you can remove yourself from like, what am I doing that's important for what I'm doing? And you start to think about the other, pieces of how it all fits together in the room. You're not so just locked into like, my job is the most important and this is the best. You learn how to work more as a team because your mind is kind of fixed in that collaborative piece. And there's also that spirit of service that you bring to nursing, and that's that compassion that you just are called to take care of things. Like if it's something that you feel that you can take care of, like go handle that. Like that's like no, there's nothing that's too small that could get otherwise get overlooked. But I just there's a lot of care for Mercyhurst in that education to shape it a certain way, and that's super important for any nurse to have that.
I liked how you spoke about compassion and service
Hmm.
and how Mercyhurst really does focus on service. And that's, my favorite definition of compassion and empathy comes from a book, Compassionomics,
Hmm. Ooh.
by Doctors Treziak and Mazzarelli.
Okay.
And and they talk about empathy being
Hmm.
so essential, but empathy is feeling another's feelings. So you
Yep.
feel the pain of your patients. You feel somewhat what they're going through. You understand it. But that can be even hurtful for the person who is empathetic, correct? Compassion takes it to the next level.
Mm.
Compassion is feeling another's pain and wanting to do something about it. It's that action oriented.
Mm.
And that's where service is not only beneficial to the patient as we show them compassion and we act to serve, but it's beneficial to us.
Yeah.
And, with higher burnout rates and everything, people tend to pull back and say, oh, I can't do everything. And they found through rigorous review of research that it isn't serving
Mhm.
others, that we, have less risk of burning out.
Yeah.
So I'm so glad you brought that up as far as both the critical thinking and then compassion.
Yeah.
Um, so, how do you personally, or do you use mindfulness, reflective practices, physical activity? How do you use what coping mechanisms and health and well-being do you use for yourself so that you can best care for
Okay.
others?
Well, I have two dogs. um, so they keep me moving. You may think you want to lay in bed a little bit longer, but you don't have the option, or else you're going to be cleaning something off the floor. So they keep me very active. I also am really blessed with a group of friends that like to do active things. So we, instead of like going out at night, we're hitting the Pilates machine together on Saturday or Sunday mornings, or walking out on, I mean, luckily Tampa, you can kind of go outside 365 days a year. So we have a really beautiful sidewalk. I think it was the longest continuous sidewalk in the world at some point on Bayshore Boulevard. So you can get like a good 5-6 mile walk just walking like half of the way on Bayshore. I also like to read and spend time with my family, spend time with my friends. My husband calls me just the master networker, that I am always in touch with somebody, and I can not be in touch with somebody and then all of a sudden just pick back up, and like we don't lose any pace on that. Like it's just something that I don't know, it's something that I do. Um and what else? And I really love traveling. Like there's really not a place where you couldn't put me on a plane and send me. Last year I was really lucky. I did a lot of personal and work travel, and it was the most I think I ever have in my life. And it was a wonderful experience. It was a little crazy at the end to think about how many places I had been, but I used that too to catch up with people. I don't know. Maybe that's the curiosity. I'm nosy and I like to know what everybody's doing at all times, and that's that's
Oh,
that that's
neat
how I,
ways to
yeah.
renew and refresh,
And
right?
stay hydrated. That's just, stay hydrated and get good sleep. But like I know that I'm talking to traditional undergrads, but my nickname in college was grandma, so I've always been going to bed no later than 11 p.m. and no caffeine after 4 p.m. Those are my rules.
I didn't know you had a nickname of grandma. That's
Yes.
hysterical.
So when I worked night shifts at Hammett, my college roommates were like, "Do they know you? Do they even think you can stay up that late?" So no, and that's something to know as you get into practice. So there are people who are very much suited for a night shift, and there are people who are very much suited for a day shift. I am suited for the conscious, surrounded by people of the day. There are people who want to go to night shift and never leave, and I bless those people. I'm so glad they exist. So that's also part of knowing yourself.
Knowing yourself, right, right. I'm curious, what motivated you to continue your education to be a nurse practitioner? And then what challenges you identified? It was a very rigorous program. What challenges did you encounter along the way?
So two people. My mother is a retired educator and has her master's in education, and I always thought to myself, there's no way, like if my mother has a master's, I can have a master's. So that was a motivator. But her sister, my aunt, is a nurse practitioner, and I she ran the health department in Akron, Ohio, until she retired, and I got to go to work with her when I was in 8th grade, and I thought all she did was give shots because she had a clinic in the mall, and she would bring flu shots to our Thanksgiving dinner and give us our flu shots after we ate. So I'm really passionate about flu shot season. I can't wait to start giving shots again next year because I've really missed that. Um, but my mom always said, she was like, don't be a teacher like me, be a nurse like your aunt. But I really happen to love teaching because I think it might be just in my genetics somewhere, but nursing also is. We have a really lengthy nursing history in my family, and my great aunt was actually a private duty nurse to Harvey Firestone of Firestone Tires, and I was told that he left her something in his will when he passed away. So we have a really late, and my aunt was very close to her, so I'm very close with my aunt. So I felt like we have a very similar thought process. We have a very similar interaction with people. Probably a little stronger of a personality, but her and her nursing element is just amazing. And she's super inspirational to that effect. And the master's program was was very rigorous. And I also worked full time, did my 3 12-hour shifts. So I'd work Monday, I worked every Monday, Friday, Saturday. I went to clinic Tuesday, Wednesday, Thursday, and then I actually taught Pure Barre classes on Sunday. So I had days a week for a good period of time. Somehow never got sick. I don't know how that happened. And I did have some support because I'd also bought my first condo, and I had my parents move down from Ohio for about 3 months. We were living in a very small space, and they were helping me set it up. So there was also like healthy food, and I was resting. Like there was someone kind of policing me a little bit. But at the end, when they kind of watched me do all this work, and my mom made the comment like, I don't even know how you did all of that. So when I got to the end, I knew I had kind of stretched the boundaries of, you know I stretched the boundaries of probably of like what I could be doing for academia. So for my doctorate, I took an individualized curriculum plan. So I just do one class every semester, and it's so enjoyable to do school. It's like it's a hobby, but it also I get to engage in that deeper learning is what my course is what my chair tells me, because I really get to take what I learn and almost immediately apply it into my job. So it's made this like really rich educational experience that's reminds me a lot of my BSN time. And it's it's also a very precious thing to be able to apply and deeply learn and present and write. And I really love doing all of those things. So the doctorate's awesome.
Excellent. Wow. Wow. What do you wish first and second year nursing students understood about the importance of being present and listening and not just doing tasks?
Oh my gosh, it goes back to that critical thinking piece, because if you can sit and listen, and if you can go into a patient's room, if you can go talk to anyone on the team, if you can go up to a physician, if you can be present and sit and just let people tell you, they will tell you what they need. Like, you really think that the way that it's set up in your assessment courses, you think you have like these tasks to do, and you have to go in and you have to ask these really specific questions and like tick through all of the systems. And I have just found that if I go in and you use a lot of your like powers of observation, like people will show you and tell you what's wrong with them, and you don't have to sit there and do this like interrogation. And I don't know if it's from my mom asks a lot of questions. My husband, by the nature of his work, asks a lot of questions, and he's so good at it. But when you're trying to get to the heart of what people are like, what motivates them, that's a huge thing for nursing, especially when you're talking about dealing with anything in a chronicity standpoint. um, you want to find out what's important to people as people, and once you figure that out, you can that's just the key to getting them to engage in their care in a way that is best, but like they might fight you on it. So trying to listen, and you kind of serve them back an idea and that make them think that it was their own. And you don't get that if you just like pop in and you just start listing off the questions. Just a normal conversation about, whatever it is that you're in the room to do. Um, I, you really get a lot of information that way. It's not as probing, I think, as you might think it is in the beginning when you're still feeling a little bit awkward in those interactions. It gets
When
better.
did when did you first start to feel like a nurse, like a real nurse? I know you have a family of nurses, but when did it really feel like to you, I am a nurse?
Oh my gosh. Probably, I mean, some of the situations I dealt with on the trauma floor, like even as like a brand new nurse, there were probably a couple where I was like, oh yeah, that was really nursey. That was, that was really nursey of me. Um, I it's probably somewhere on the trauma floor, or maybe when they put you in charge for the first time. That's kind of a big milestone. Although I think they put me in charge the first time, and they also gave me my first preceptee at the same time, and that was that was a lot. Um, but it's somewhere between like feeling pretty good on the trauma floor, and then probably being charge nurse for the first time when I came down to Florida. Like that's where it starts to get real. And getting my orthopedic certification, that felt really good. That felt like I had acquired a knowledge base enough to like take another set of boards that was specific to the area that I was practicing in. So that was really cool.
Mhm. Wonderful. And just speaking about questions, yeah,
Mhm.
as nursing students, we just
Yeah.
go in, we have our list,
Yes.
we're signing things off, we're making sure we ask every question. And I know one
Yes.
of my favorites is just asking what matters most to you.
Yes.
And you can, so like you were saying,
Mhm.
just listening, being present, people
Mhm.
will share what matters to them. And if it matters to them, they're going to be more likely to make changes that need to be, made, or take a medication or do a certain
Mhm.
lifestyle change. But
We used to have the boards in the patient's rooms here at the hospital. They've been replaced with these fancy Epic boards, but it used to just be a dry erase, and the bottom of it said, what's the most important thing?" So we were prompted to ask that. But the other observation that I've made, especially with the elective surgery patients, is that the greatest thing any patient can have to help themselves is intrinsic motivation. So when I go in and you start having a regular human being conversation, it's the patients that tell me, I'm planning a trip to Europe in 6 months, or my daughter's getting married in 3 months and I'm walking her down the aisle, or I want to go out in my garden, or I want to play with my grandkids. Those are the thoughts that will rehab the patient from whatever it is. It's the rooms where the people have lost some of that, like that will to, I mean, it's effectively a will to live to some extent, but when they're not communicating something that they're looking forward to doing, like it's just good in general to have something to look forward to. So that's something that I might try to elicit, like, oh, are you planning anything after the surgery, or like what was the reason you wanted to proceed with surgery? That's something that's really figuring out like what their personal goals are, and that's something that really that's those are conversations that should be had throughout the continuum of care, whether they're being seen in the office, pre-op, post-op, follow-ups, like knowing that is just that's a huge that's just that will hugely impact the way that you provide care. Because and you're also, when someone is motivated, they're a little more ready and receptive to receive education. Like there's a lot more that you can do with that patient when you identify that.
Excellent. This question is kind of chock full, so you can
Okay.
take any one piece of it that you'd
Got it.
like to speak about.
Sure.
But what have you learned over the course of your education and your clinical expertise about the importance of advanced directives, palliative care, or supporting patients and their families that are facing dementia or a serious chronic illness?
I mean, from a state of palliative care and hospice are two different things. That would be the first thing I would say. Um, there is a wonderful book called Being Mortal by Dr. Atul Gawande, and I would recommend that for anybody because it is beautifully written and described about his parents, one of his parents' journey into the hospice space. um Palliative care is something that can be applied with with like a COPD diagnosis or heart failure diagnosis. We do not deploy these services enough because colloquially we think it's the same service. And we don't get hospice out soon enough either, because you want you want to employ these services as you have them because it helps with symptom management. And like as someone is approaching the end of their life, if that is what is anticipated, like you're not going to be taking them out of their home and going and worrying about what their sodium level is. Like it just, there's a certain point where the practice of medicine is just like not the focus. It just does not become the focus anymore. And it's the quality of life for the person and the dignified like transition, as it will. And how and what that is for each person is different. So that's why an advanced directive is very helpful, or that they've had these conversations with their family members, so that they know what the expectation is. My best friend's mother passed away from a glioblastoma last year, and I don't work a ton in this space, but I felt like I was the on-call consult. And they kept her at home. Her family did all the care and the meds, which was just astounding. But based on what I know and what I've experienced, I mean, they gave her the most dignified death, and they did it to what her wishes were because she did not want to leave the house. So they really acted on what they knew she wanted to do. And interacting with a family, you talk about compassion. One thing I learned is that in supporting, if it's a personal situation, if it's a work situation, I think the best thing that you can do in those is you really don't, people are under enough stress. You just start doing what is right, or what you think might be right. Like, I'm not going to ask my best friend if she's eaten a meal today. I'm just going to send a gift card, that to go to Tim Hortons, or to just like get a reason to get out of the house. And then when it comes time I just got on the plane and went up. I didn't wait for her to be like, we want you at the celebration of life. I was like, you just don't get an option. Like, I'm just going to be here. So I, that experience I learned a lot about, because the patient, her mom she had 3 or 4 brain surgeries over a period of 2 years, and she was such good protoplasm surgically. Like, she didn't need to stay in the hospital for more than like 2 days at a time to do multiple brain surgeries. And like, this woman was so healthy, and it really, I think the biggest thing it tested was, watching that was your faith, because you're like, how can I wrap my mind around an otherwise perfectly healthy, on no medication 72-year-old woman get taken out by a brain tumor? It's not fair. um, but there was so much good that surrounded that. It was that altered my brain.
Mm, wonderful. I just heard about, and I actually have her book at home,
Mhm.
Hospice nurse Julie, I believe. She
Oh,
has a podcast
okay.
and she's written a book. She was a hospice nurse. She's a young woman,
Yeah.
a young nurse who has been working in hospice for, I think, about maybe maximum of 10 years.
Hmm.
And she just shares in this beautiful way of sharing in her writing
Hmm.
about patients on hospice and for families mainly to help them understand what death may look like, etc. And
Yeah.
she has podcasts too. So I'm hoping that in that content, when we go over advanced directives with this in this course, I'm going to put in a podcast or two from hospice nurse Julie because
Yes.
it's those beautiful ways of caring for others
Hmm.
in palliative or hospice care.
The other note that the best thing I ever heard about the physical document, if your patient has advanced directive and if they have it on a document, it's not the fridge that you tell the patient to put it on. You tape it to the back of the front door so that if someone is going out, they will grab it. So I actually did that for my grandmother, one of my grandmothers-in-law. My husband has three grandparents over 90 all living at home. The first one passed
Oh,
away just about 2 years ago. So he was also in hospice for, I think it was like 14, it was like 14 months of palliative care and hospice. Just he had a lot going on, but yeah, that was the one, that is a note that I took from a physician that's like in my head. I heard her say that to a patient. I was like, that's one of the best things I've ever heard about the placement of the actual document, if it's the one pager, just to put it there because you don't know when, if EMS came or whatever the situation may be, no one has to look for it. It's just right there.
excellent, excellent. Um, I know we're kind of getting on in time, but
Hmm.
I wanted to ask you maybe two more questions. How do you stay compassionate when patients or situations are emotionally difficult? And I know there is a higher likelihood of experiencing violence, whether it's, verbal abuse for nurses, but how do you stay compassionate in situations that are truly emotionally difficult?
I think, compassion fatigue is real. So I think acknowledging that like there is a limit to where that you can only have your bandwidth can only go so far. Um, sometimes I find that like it's the people in the hospital, even if it is a situation where people where they're, de-escalating techniques and like how to kind of just generally calm people down. I just assume that there's nobody that's really coming in, and if they are escalating or raising a voice, that it's situational, right? It's like that's not directed at me. It's just like the situation is bad. And sometimes just being upfront with that and saying it is like this is a terrible situation and I do not want you to be dealing with this situation, but this is what it is. you know I have found that really useful. The surgeons get in all kinds of, there's a lot of emotional situations in terms of surgical complications and seeing like what happens to them mentally. I've pulled a few back and I've been praised by them for my ability to interact with them in like bad heated situations. Again, you're the nurse for everybody. So it
Yeah.
goes beyond, you have to extend that to work. I find it probably the hardest to extend to family because I have very obstinate patients when it comes to my own parent, when it comes to family not wanting to, they ask my clinical advice, but then they don't follow my clinical advice. So that's where it's probably the most emotionally taxing. But in terms of, I mean, you see things and it's like, man, that's bad. Like and you always think like this could be worse, like this is bad, there are worse situations. Like it's just kind of putting everything into perspective, like just a constant check of where you're at. And even knowing like, is my compassion fatigue like on today, or like do I have bandwidth? Even if there was once after I had a medical situation and came back from a couple weeks off, and there had been a patient that had been there the whole time that I had been out, and it was like this patient was like on respite for no reason. Like she was turning into a potato actively in the bed. And I told one of my surgeons, I said, did your team round on her this morning? I said, because I can't go in there because I'm like, I said, I can't do it today. Like I can't see her not wanting to help herself
Mm.
today. Just like not in my bandwidth. And he was like, no, he's like, you're good. He's like, you can take a break from today. But sometimes you have to just have that conversation if there's something that's just really challenging. And also, um, here at the hospital, they talk about in those situations, like going in pairs, like take a buddy. Like if you're finding a situation really hard to navigate, just like find your work bestie and just say like, let's go in and just do this together. I want, just maybe somebody else can meet them differently, and that sometimes is all that it takes. Just like get a little bit of a different perspective.
Thank you. And then just the last question, because I'm not sure if this is going to turn off or not. It said I had 5 more minutes, but I don't want it to. It shouldn't. It should allow
Okay.
me to tell it when
Yes.
it's done. But is
Yes.
there anything you wish nursing students understood earlier about caring for people living with chronic illness?
Living with chronic illness, like it chronic illness, I mean, it's just like constantly working through that nursing process. And it's not, you know, there's just a lot of there's a lot of patience that the human body requires. It's a lot of patience. It's a lot of, you have to you're dealing with the human body. You just have to you make plans to do things, and God laughs, is what I've been told. So like you can think that you've got the patient on like a great plan to help them manage, and then they're right back where they were, and then you're like, okay, we have to come up with a new plan. Have a plan B. Like use I mean any patient situation, either chronic or acute, like turn your critical thinking on immediately, and just, take into account that whole patient, like mind, body, spirit, like just from the beginning. And I know that you have a lot of tasks and a lot of assessments to do, and you want to look at you need to look at labs and look at vitals and look at meds, and you're like creating a whole story for this patient. But like really work with the patients, meet them where they're at, find out what makes them tick as human beings, and just know that like we're not in this the human it's you're never going to get perfection from the human body. So like it's just constant, it's constant work. Like that's why the work is never done. So just, you know if you have those perfectionist tendencies, you just kind of have to just you have to set them aside. Also, I also like small goals. Like sometimes it seems like, oh my gosh, we've got this big problem, and post-operatively, I think dealing with a post-op patient can be like this. And if a patient is really feeling how big the problem is, then you start with small things and you say, okay, your goal today is to get out of bed. And you give them like one thing that you want them to do, and you start with that one thing. And that will mean they're going to come back, but then when they come back, they will have done the one thing, and so then the next time you give them something new. It's just there's a lot of creative problem solving as you come up against each individual. And then once you see them respond, and you kind of you make you create that relationship, and you have those attending skills, and you sit down and have a conversation with people, and you don't talk to them while you're trying to like maneuver the mouse on the computer screen. Like you go in there and you just relate to the individual and figure it out, and just think creatively and think deeply. And maybe that's you. And I know that you don't feel like you're at the point where you can do that yet, but it's good to and this is one thing Mercyhurst does well. It's good to hear about something before you're ready to put it into practice, because one day you'll be in practice not so long from now, and you'll be like, oh, I remember, this is where I'm supposed to be. creatively. You'll hear that somewhere, and then that will be very good.
Yes. Well, Noelle, thank you for sharing your wisdom. And especially, like you said, as the students are in practice, they're going to think back to the words of today that you shared with them. So thank you so much as one of our valued alumni at Mercyhurst. Thank you for sharing your time and your knowledge, your wisdom. I so appreciate it.
You're so welcome. And if anybody, please, if Dr. Stanley has my contact information, so if anybody wants to reach out, send me an email. If anybody wants a job in Florida at some point, we might work on something, but I'm always happy to mentor any nursing student or new nurse or seasoned nurse. I'm happy to talk about all of the above.
Wonderful. Thank you.
You're welcome.